This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And I'm now joined by Dr. Jorge Eisenchlas, past president of the Latin American Society of Palliative Care, member of the Board of Directors of Worldwide Palliative Care Alliance, the WPCA, editor of the e-Hospice publication for Latin America, and past president of the Argentine Association of Palliative Care. Welcome.
Thank you very much.
At this ESMO 2012 Congress here in Vienna, the first results of an ESMO-led international collaborative project on the regulatory barriers to being able to access opioids for cancer pain management were presented. So could you speak to us a bit about the survey results?
The survey results really was a bit expected for Latin America. We had not surprises about the results, but having not surprises is not the same to say that there is no benefit. I think that the survey gives us a large benefit in terms of having a systematical collection of every data for most of the population living in Latin America and across the world, I think. This makes that we can use those collected data in a proper way now. We now know what happens in every country, what are the differences between countries, and that could make a plus regarding the way we can approach governments and authorities in terms of improving opioid availability across the world. In the Latin American setting, there are high inequalities about what happens between one and other countries. And we stream to have a more common pattern of opioid availability between countries, what is lacking in the Latin American area. Really, there are many problems in our countries. Poor people is not benefited from very cheap drugs used to alleviate pain. And we can say at this moment of the century that alleviating pain by cancer is a human right. So we are not talking about any other pills. We are talking about cheap medications that have proved to be very useful for alleviating pain in people who are approaching death. So we have the duty to alleviate that, and it's not happening in the Latin American panorama.
Now that you have been able to review the survey results, what are your next steps?
We need to think deeply about this. There have been some paradigmatic cases which can be taken as examples of how governments had been approached having adequate data. And we should think in using some part of those cases in approaching authorities of different governments. But the reality of every country in Latin America is different to the neighbor country. So we need to design the adequate strategy to approach every health government authority. This is not a matter of only scientific issues. This is a social issue. Somewhere someone said that the way people die reflects the justice of the society where people dies. And we should not allow that people suffering illnesses which threaten life would have pain, when pain is so easily treatable and so cheaply treatable. So, the developments to be done from the survey, as I said, need to be integrated in a whole strategic, but that whole strategic and broad strategic should be adapted to every country, but not only under the scientific ground, but under the social ground of the problem. We should give the voice to the patients to say what they think about what is happening with them. I know it's difficult to have a sample of patients so representative of every country. You need many patients to do that. But you should guide by testimonials of many people suffering cancer, of many people suffering neurodegenerative diseases, of many people suffering COPD. It's not only a term of cancer. Most of us will die from chronic diseases. And chronic diseases are accompanied by a large number of symptoms, and pain is one of the symptoms which more impact over the whole person. We need to address our efforts to do that.
Thank you so much, Dr. Jorge Eisenchlas, past president of the Latin American Society of Palliative Care, member of the Board of Directors of Worldwide Palliative Care Alliance, the WPCA, editor of the E-Hospice publication for Latin America, and past president of the Argentine Association for Palliative Care. Thank you for what you do.
Thanks, it's a pleasure.